In the letter to the U.S. Trade Representative Katherine Tai, the 12 Republican members of Congress led by Representative Jim Jordan make their case for not allowing the waivers, calling it extraordinarily broad and unnecessary to accomplish wider access to COVID-19 vaccines and treatments. Their letter reads, "The justification for the waiver rests on an incorrect assumption that IP rights are a significant bottleneck to the widespread availability of COVID-19 vaccines and treatments. The waiver sponsors have presented no convincing evidence to support this assertion." But South Africa has a different view.
The scope of the waiver has been carefully thought through, and the aim is to target specific and certain provisions of the IP regime in the WTO that are vital to the production of vaccines, therapeutics, and diagnostics. And we have targeted it when we were looking at the specific products that you need. You need PPE, you need vaccines, you need therapeutics to be able to effectively respond. And we identified those specific IP rights and IP provisions within the TRIPS agreement that are necessary to enable production of those products.
Mlumbi Peter pointed to the fact that more than 2 million people had died globally since their proposal was initiated at the WTO in October last year, and said the time had come for the WTO TRIPS Council to move to text-based negotiations on the proposed waivers.
The current production capacity that exists is around 3.5 billion doses per annum. And what is required to effectively respond to the pandemic is 14 billion. So the current manufacturers do not have enough capacity to respond to the 14 billion. They can't meet the global demand. And what is important to meet the global demand is to address the barriers to production. And we also agree that IP is not the only barrier, but IP is one of the significant barriers that will unlock production.
At the root of global concerns is the current disparity around vaccine access and distribution, with 1 in 4 people on average receiving vaccines in richer countries, while in lower income countries it's 1 in more than 500. Sherwin Bryceby's SABC News, New York.